Welcome to page 105 of Anatomy Coloring Book. This is Dr. Stephen Harkins. We've talked about the chambers and the direction of flow in the valves, but what organizes and causes these, and the timing of the contraction of the atria contracting and squeezing and the ventricles contracting and squeezing? Well, there is within the heart, in the muscles of the heart, nodes. There are two nodes, the sinoatrial node, or the SA node, and the atrioventricular node, or AV node. And these nodes sort of modify the signal and signal when and tell these muscles exactly, these cardiac muscles, exactly when to contract. So the SA node, the sinoatrial node, will tell the atria, right and left, when to squeeze and contract and send their contents into the ventricles. The path, it's called the internodal pathway, the path that is taken by the electrical signal to tell all the muscles of the atria what to do. That's the intranodal pathway. The atrioventricular node signal travels down through the atrial ventricular septum, or the middle portion here, and travels to these fibers here called Purkinje fibers, or the Purkinje plexus. These are sort of specialized fibers in the heart. They're not contractile fibers of the heart, but they're special fibers within the ventricle walls, within the muscles, that respond to these signals. This part here is called the AV bundle, and these are your Purkinje fibers, or the Purkinje plexus. So when the signal goes out from the sinoatrial node here, the atria and the two atria contract and squeeze at the same time. Send their contents, the blood, into the ventricles. Then the signal goes out here from the atrioventricular node down the AV bundle and branches to the Purkinje fibers, or these ventricular muscles to squeeze and contract and send their contents through the aorta and the pulmonary arteries. So it looks like this. Oxygen poor blood here. Oxygen rich blood in red. The oxygen poor blood enters the atrium, while the oxygen of the right atrium, while the oxygen rich blood at the same time enters the left atrium. When the sinoatrial node gives off its signal, it can be measured. You can put leads, it creates a voltage signal because there is depolarization of the cells, and it creates a potential difference that can be measured, an electrical signal that can be measured. And that's what an EKG is, or an ECG. EKG, same thing. The P wave So this can be read on a signal. This action right here, when the blood, the oxygen-rich blood, is squeezed out of the left atrium, and the oxygen-poor blood is squeezed out of the right atrium, that signal, it does so in response to the SA node, the sinoatrial. And that signal can be read with a device called the EKG. And when that happens, it's read in a P, what's called the P wave. That's the sinoatrial node giving the signal for the both atria to contract. Then, after the blood, the deoxygenated blood is in the ventricle, and the ventricle is nice and pumped up with blood. The right ventricle and the left ventricle are now both pumped up with blood. The atrioventricular node now sends its signal to the ventricles saying contract. And you can read that signal on a device called the EKG as well. When that signal occurs from the atrioventricular node, the AV node, there is a huge spike in electrical activity that can be read, and that's called the Qrs wave. When all of this blood, deoxygenated and oxygenated from the left ventricle, is slammed out into the ventricles or into the pulmonary arteries and aorta. Let's make this purple for contraction there. And that signal, as I said, can be read, and it's known as the QRS wave. When the SA node contracted, it was called a P wave here. It can be read on a graph. When the atrioventricular node sends out its signal, called the QRS wave, and it can be read on the graph. This is called the QRS complex. And finally, the T wave. When these ventricles relax, after contracting, they let go and they relax. And the atria fill up again. So the ventricles are allowed to finally relax after making their big push. There is actually an electrical signal at that time too, and blood, new fresh blood, begins to flow back into the right atrium and the left atrium. The ventricles relax and they expand again, or at least they relax. This repolarization, as it's called, sends off a little signal as well, and it's called a T wave. The signal can be read, this electrical signal can be read by this EKG, and it's called a T wave. Why a T wave is in the positive direction, since it's a repolarization, not a depolarization, is complex and beyond the scope of this class. And so we won't deal with that, but just know that the sinoatrial node contraction is signified by the P wave. The atrioventricular node contraction or signal is signified by the QRS wave. And then the repolarization of the ventricles is called a T wave, signified by the T wave. Now, the other in between waves, PQ, intervals, ST, TP segments. They're for your own study, and just read about them down in here if you would like to know more information. But the basics of the EKG for our intensive purposes are the P wave, the QRS, and the T wave. And this has been page 105 of Anatomy Coloring Book. This is Dr. Stephen Harkins.